Namaskar, I Dr. Rajesh Kumar Sharma, Professor and Head Department of Critical Care Nursing and Coordinator for Skill and Simulation Center of Swami Rama Himalayan University. So, in this module we are going to discuss about the team dynamics for high performance team during the basic life support. So, as you know that basic life support is a very important procedure and it really need team effort, and without team effort no objective is gained. So, that is why it is most important that every team member of basic life support, they must know their role and responsibilities. So, team members of basic life support, they should be proficient in performing all the skills of basic life support, and they should be clear about the role assignments which have been given to them, and they should prepare to fulfill their roles and responsibilities whatever is given the time of basic life support. They should be well practiced in resuscitation skills which were required during the basic life support, and they should be well knowledgeable about the algorithms which we are doing during the basic life supports, and they also must be committed to the success, because we are committing for the success, not the failureness, because success only means that we have to save the life of a human. So, that's reason we have to commit it for the success. Next is team members role, especially that CPR coach. CPR coach is a most important person who really do major role as a leader also, as a coach also. You have to coordinate the start of CPR, that is most important, and here also see that improve the quality of CPR while doing the chest compressions, and he also should state and coach the mid-range target. Mid-range target means if a person who is not up to the mark and is not able to compress chest appropriately, so in that case he should motivate him that he is doing better one, and we should guide him also to give him quality CPR, and he should also minimize the length of a pause during the compressions. So, he should not, because we have to see that pauses should be very less, interruptions should be very less, then only we can reduce the duration of the pause in the chest compressions, and we have to see the better chest compression depth, even though we have to see that for an adult or pediatric or neonate, as per the guidelines, that chest is compressed appropriately like 5 centimeter in adult and 4 centimeter in neonate and pediatrics, and we have to see that improved overall excellent CPR. And then we have to see the every team member should know their limitations. As being a team member, you should have your limitations, because we can call for any time for assistance, look for the advices. If you really need some advice, please go for the advice. Do not feel that no, I do not know, you need some advice, please. And then allow others to carry out assigned task. If the person, if you are not able to carry your task, maybe due to any reason, please allow others also other to complete your task, because here task is important rather than personal reasons, because we are saving the human lives, and we always should accept the assistant. As being a team member, we should see that constructive interventions. So, whatever instructions we are doing, whatever care we are giving to the patient or doing any interventions, so that should be constructive rather than destructive. We have to communicate. What to communicate? That is most important over here. We have to communicate, we can share our knowledge, that is most important, because while doing the CPR, if sometime it may happen that you do not know appropriate steps, or maybe some how to compress the chest, or maybe you do not know the rate also, in that case you can ask frequently someone, you know what is the rate, we should maintain it. So, in that case we should share the knowledge, and in the last of the procedures we have to summarize and reevaluating we have to be done, because that is most important while doing the CPR. How to communicate? That is another aspect of it which is very important. We should go for a closed loop communication. Closed loop communication means, like if somebody is giving instruction to someone, then the person should say, Mr. RK, you give injection of dopamine or adrenaline. So, in that case we are doing closely we are telling. Closely means that directly we are doing the communication, and now that Mr. RK have the responsibility of telling the person who told to him to give injection, yes sir, I have loaded the injection and now I have going to give it. So before giving, he have to give the instruction. He would ask to that I am going to give it, and then he said, okay, you go ahead. And after that, again, after giving injection, again we have to tell him, yes, I have given 2 ml or maybe 1 gram of adrenaline to the client. So this is whatever medications or whatever number things we are doing over there on the patient, we have to be tell every time. That is a closed loop communication, and whatever message we are giving, it should be very clear. Like give injection IV or IA, how much should be the dose, what should be the medication, and what should be the route. These all things we have to tell very clearly to other team members. So there should not be any miscommunication, and we have to be the mutual respect, because here we should not shout to anyone and we should not misbehave with anyone. So we have to be very mutual respective, otherwise because it may create the problem because then in that case the procedure will not be effective. So that's reason we have to mutually we have to respect each and everyone. So that is about the team dynamics while performing basic lab support for a successful BLS. Namaskar.